decided that she would donate to the project. So without having a campaign, we've gotten $300,000. So
Wow.
I think that hopefully speaks to what our success will be in the future.
You have any bricks left?
How much does the capital campaign need to raise? About 25 million.
1.5 million, right?
Oh.
Is what we're looking for.
Oh,
Yeah.
1.5.
Yeah,
Your last
we've
capital
raised
campaign
300.
was
It
5
million. Yeah.
I'm sorry?
5 million for the
5.
last one, Chris. And one of the unique things that we're doing now that you guys have been very supportive of us is the Art Up project.
Oh, sure thing.
Yeah.
And we're very thankful for that, and obviously for all your past support. But the Art Up project, Claire, maybe you can just give us a quick, or not?
Oh,
Run down the health
An art update.
project. Yeah, an art update.
Sounds like you have more hallways, you need
Yeah.
more art.
yeah, right. Right now we've sold, I think we're up to 61 pieces
Mhm.
and raised about $68,000. Most of the artwork that's been purchased is now up. There's just a couple of pieces, a couple of big installation pieces that are gonna go up. It's been a great project. I think it's, thank you for all your coverage because it's been really helpful. But it's been a really great way to engage a new sector of the community that maybe was not aware of what we're doing, but also to partner with another important part of the community, the arts community. So, we're looking forward to forging ahead with that and selling more pieces between now and the end of the year.
Maybe when you reach a milestone, like 100 pieces of art, we revisit.
Okay,
Yeah,
that's
something
great.
like that.
That'd be great.
That'd be
It's
great.
okay with the boss, but,
Yeah,
yeah.
it's okay with us.
So, did you mention 25 million as a project cost?
Yeah, so I was
Yeah.
gonna
No.
clarify that. So that was that's what we put in here.
Yeah,
So
right.
that's
It's
what-
25
That would be,
That would be
for everything.
including,
Pardon?
That would be for everything, that would
Yeah.
be including the housing piece.
so for
Oh,
all
sure,
6
yeah,
floors,
yeah.
not just the health center part.
Right, okay.
We've also given you here some of the stats from an assessment that Harvard Dental residents did at the health center. I think we were all a little bit taken aback at the need that they were seeing as they looked in people's mouths, as they talked to them about their dental care, or rather lack of dental care. So we know that our patients are in need of dental services.
Dorcas, who
There's a
comprises-
connection- There's a connection too between dental care and regular health, and from a personal standpoint, I mean, my mother went for a cleaning that was some sort of special cleaning, and they gave her antibiotics to take, and she didn't take them the way she was supposed to, being a poor, stubborn Portuguese woman, and ended up in the hospital with renal failure. So
And the
she
connection
recovered,
with heart
thankfully,
disease.
but, there's a big connection.
Dorcas, which demographic comprises your biggest patient group right now? Is it Cambodians or Southeast Asians or Africans or? It's a
Yeah.
rather broad question, but can it be answered that simply?
Sort of.
Yeah.
Yeah. So if we look at ethnicity,
Yeah.
so 30, I think it's 32%, actually it's probably, you probably.
Oh, it's in that,
actually
okay,
did,
okay.
Are Latino.
Oh, okay.
And then I think it's around 28% are Asian, mostly Cambodian, of course, and about 7 to 10% African American or African immigrant, mostly African immigrants, and are refugees, and about 7% Portuguese speaking, Brazilian and Azorean, and so that's roughly. And if you look at age, about half of our patients are 18 or under.
Really?
Wow.
Close to half. And then we're actually seeing more elderly than we have in the past. I think it may be up to around 10%, close to 10% elderly.
And I imagine most of these people are getting health care for the first time when they do become your clients. Is that?
Many times they are. One of the things that we found with healthcare people got insurance, they were coming in with very acute illnesses, very complex medical conditions, and really hadn't seen anybody for 8-10 years. So that was, I think, kind of a surprise to us that there were so many people coming in because they now had some form of health insurance. And
Do they have to purchase dental and vision supplements, or is that covered in the basic health care that they receive?
some dental is covered by Mass Health and by the Health Safety Net. Vision, I'm not, actually, I don't know yet.
Hmm.
We're learning. Can find that out.
That's good.
I serve on the board of Circle Home, which is also affiliated with Circle Health, and Jody White is on the board as well. And Jody was talking about how the hospital's just gone through this major expansion, and Bruce, you can attest to this, I'm sure, but he was saying that, you know, the additional beds that they added are full. The emergency room expansion, they're above capacity.
Yeah, they wanna do another one now, right?
And
Intensive care.
yes, but for the health center, because that's where people would be going, right, for their care, if they weren't going there, they'd be overwhelmed.
Yeah.
Any new jobs in this? How many jobs do you think are going to be?
Definitely there are new jobs. I don't know that we've mapped that out, although we should have in the budget. So with the expansion that we've just undergone, there were about 100 new jobs. And so I anticipate, you know, maybe it'll be half of that in the new building, but I can get you a better number.
So there is a bigger economic impact.
Yeah.
on this.
So one of the things you have in your packet is an analysis of our economic impact on the community each year, which is around 46 million. It kind of breaks out how that's looked at using sort of industry standards. But increasingly, not only have an impact on the health of individuals and families in the community, but really the economy.
Mhm.
Nice to
Sounds good.
be helping out the.
So when are you going to kick this off? The campaign and everything else? And is this it? Is this your campaign?
Well, I
kickoff?
think this is a good first place to start to get the word out. And right now, we're depending on Steve to get the internal workings going. And
Him?
So we can blame him if it doesn't.
once we get the financing
Steve, can you comment?
locked
No,
up,
no comment.
we're good.
Good. Good.
Right, certainly cannot.
So you've got a deadline. You've got to get this thing together by January, right? So
Yeah.
Right, so we've already engaged architect and construction company, plans are.
So we have
way
schematic
down the line.
plans, you know, we've got the program all planned out in terms of where the uses are going to be and how they're gonna relate to the existing uses in the existing building space. We have schematic plans that have been done,
This is-
and Friday
that's
we're
the
meeting to talk
that's the
about,
Okay. So it's
you know,
the
the
second
next step in
down,
terms of
it's on,
cost
you come over
estimate.
the bridge, it's down here, it's that.
Oh, so it's in the same building?
They've got this like.
Yeah, we're scheduled
Okay.
for, we've had meetings with city officials, you know, the planning department, and we're in the chapter 40 R district, so it's, the two organizations that we go to are the Lowell Historic Board and the Conservation Commission.
The historic board is one of our favorites.
That's why I'm smiling.
they've come a long way.
They've been very
Yeah.
cooperative,
Yeah.
you know, they're trying to do their
Depends
best
who
to
you are.
accommodate our schedule.
Yeah, just keep the bricks natural color.
Yeah, well, we won't be painting the bricks, that's for sure.
We know the scheme now, because we've already done 100,000 square feet, so.
That's good.
Kind of a repeat of what we did there.
Yeah.
Well, I thank you for coming in and telling us. This sounds like an exciting project, and we'll help you out any way we
Thank
can.
you. You've been so
Publicity and
helpful.
stuff. And,
Through the years.
you know, just keep us You know, keep us updated as Steve does his thing and the search. And we won't ask for any resumes of the people.
That's okay.
We'll leave that to you.
I think Chris is gonna get them anyway.
Maybe just a couple.
And I misspoke about economic impact, it's over 51 million now. I was using the year.
Is that
before.
higher than UMass Lowell?
Yeah.
I would be very surprised.
Have authorization to vote up or down on those candidates.
Would that be in public?
Would what be in
The
public?
final two interviews?
I don't
Was there
know.
any discussion about that?
We haven't gotten that far yet.
Okay.
We haven't gotten that far yet. Certainly, I think it'll be pretty well known, but the board meetings aren't,
Yeah,
quote, open to the
so it's a
public.
board-led board decision.
Yeah, yeah. So, so then, once that happens, ideally, and nothing ever works out the way you hope ideally, we'd have that candidate in place a month before Dorcas's departure on May 1st, so that they would have some time to transition together.
In terms of community input, the firm will be talking to key stakeholders in the community, getting ideas from the community about what's important in regards to qualifications for the CEO.
I've gotten more feedback about what the community sees as qualifications for the person who's gonna come in and try and fill Dorcas's shoes. And someone who has a real sense of community. It's a very strong quality that our supporters, our financial supporters from the capital campaign that we did, are giving us, that we need someone who has strong community ties that can really relate to the community. And we're such ethnically diverse population that obviously, that goes without saying, so.
Well, a natural follow-up to that statement, Bruce, the question, do you anticipate any in-house candidates?
We do, we don't know for sure, if we anticipate, I would say there certainly, we would be surprised if there weren't. But they would go through the same search process as anyone else, so the reason why I really wanted to have a search firm involved is to give transparency to the whole process. And we think it's very important, particularly with the internal candidates, that their confidentiality be protected. The timing, there's never good timing for anything, but as far as the health center is concerned, we've never been stronger. We're in a unique position through Dorcas's leadership over 18 years. She's built a strong in-house senior management team, of which Henry is here representing today. And we are in a good position, and as we move forward with this project, we feel very confident that we will continue on the path that Dorcas has led us. You look at 18 years, we started with about 100 employees. Now we're up to almost 400 employees. The budget was at about $9 million back 18 years ago. Now we're up to almost $40 million budget. The number of people that we service since that center opened in December of 2012, we've picked up an additional 10,000 new patients that have come to the health center. So, the old axiom, if you build it, they will come. I think that this is a perfect example of that. And as we're going to discuss in a few minutes the expansion of the project, I think you'll see what's going on is that we are literally bursting at the seams. We built a build-out of 100,000 square feet a couple of years ago, and we're already underspaced.
That's in the big mill, right?
That's in Unit A. So that's a little bit about what they're going to talk about. Any questions with regard to the process? I think that's why they asked me to come today. And it's very new for us. I mean, this is going to be my first executive search personally. I've sat on committees that have done it before, but I've never been chair of the position. But the most important thing for me is that it is a transparent process and that we do get the best candidate here. And that whoever that candidate is going to have strong community emotions. We know that.
one of the things that I did in thinking about when should I retire, was to really look at the organization as a whole, to look at our board. And, you know, as I kind of did that assessment of how is our organization doing these days, I saw a board that's probably the strongest board we've ever had. It's representative of the community, and it's now a board that has a very good understanding of the healthcare environment, has an understanding of what our requirements are as a community health center, and really understands what makes a community health center a community health center as opposed to, say, a private medical practice, and understands the connection that's needed between what we do in the community and what we do within the walls of the health center. And, you know, looking at our management team, our leadership team at the health center, it's really superb. And so putting all those things together and putting together that we are responding to our success at 161 Jackson Street by working on development of the building next door. So that will be in place, ready to go before I leave.
Just before we get off the executive search,
Yeah.
you know, it seems to me that executive search firms, both in the public and private sector, are a burgeoning industry. UMass has come under some criticism for spending a lot of money hiring executive search firms. The Greater Lowell Community Foundation has hired an
Yes.
a search firm, which I've written about. Now you guys are hiring a search firm. Whatever happened to the days of the board of directors going out to find a new executive director? You know, the hiring an executive search firm costs money. You're a
It does.
nonprofit. You know,
Yep.
you're not swimming in cash. At least not that I know of.
Right.
So can you just talk about that just a little
Sure,
bit?
absolutely. This is probably the most important decision that we as a board are gonna make, certainly over the next few years. And I think using the executive search firm opens a lot of doors that we wouldn't be able to open on our own. They are constantly in the marketplace talking to professionals, not necessarily people that are looking for jobs, people that are currently, so, you know, the type of person coming in, Chris, could be one of two ways. It could be a seasoned CEO who's had many years of experience and is looking for some type of a lateral move, or it could be a newcomer coming into the business. When Dorcas started, with her background, she, you know, wasn't a CEO, and look what she developed into. And so I think that the short answer is it opens up a lot more opportunities that we as a board would have access to. There are in contractual obligations under the contract with the search firm. If the candidate doesn't work out within a certain period of time, that they will go out and reconduct and re-energize the search. But our experience has been that they can find more people, better qualified people than we as a board on our own could. And yeah, we hate to pay the money, but you look at it as a long-term investment. Dorcas has been here 18 years. If we have anywhere near that same success with the person
I
following
guess you
her.
would consider that successful.
That's, but we want to find the right person. That is, yes, it hurts as a not-for-profit, but it's an investment, we think, in the future of the organization.
How much is it? How much does it cost? Can you give us an idea?
Yeah, typically it's about 30% of the salary of the individual.
Okay.
Well, we all know that Dorcas was underpaid. So what is that salary that you're proposing for the next?
I think that's something that we're actually looking at right now. We're going through a review because Dorcas has been here so long. We're trying to get a sense for the marketplace out there, and we're doing that both with our consultant and through some affiliation with Lowell General. They're helping us look at that very fact as well, Jim.
Are you
Lowell
interested?
General?
Yeah.
You
Are you
should get the
interested?
$1 million right up front now.
Yeah.
Stay another
No,
year.
I know.
Stay another
I
year.
know.
I might have really sorry.
Oh, I'm on tape. I'm sorry, Norm.
I think the other thing about a search firm is that it does take a lot of time to look for somebody. And if you look at other $40 million organizations, you're usually going to find that they're using a search firm.
But this should be a very desirable
I think
job.
so.
You've made it that, I think, and and the people who've been responsible for contributing and doing the things, so it should be very good.
But we need another figure to put that in context. So 30% of a salary, so what do you expect the salary range of the new executive director to be?
Yeah.
Well, we're not asking you for anything that's not public.
No, I would say, in the $200,000 range, just ballpark, that's what we're talking about.
That's reasonable. Sounds a little low, but reasonable. Okay.
You won't go after the job
That
after all.
means you want to apply to.
If I can take my aspirin bottle.
Yeah, you did.
That's good. All right, you done, Mr. Scott? Are you done with that?
Well, someone has to ask questions.
No,
You're just sitting there.
Douglas, in your mind, what do you think of the number, a couple of top priorities? If you had to replace yourself, which you're gonna do, I mean.
She's irreplaceable.
What do you tell your board that they should be mindful of?
Yeah, well, it's an interesting position where you really do need to be very much a part of the community. I always say that showing up is half the battle, as we hear often, and that I've shown up a lot through the years, and that's the way I've gotten to know people and really find the fabulous partnerships that are possible in Lowell, much more than other places. But that takes time and takes work. And then, it has become a large organization with a large budget with a lot of staff, and so you need all of the, you don't have to do everything, fortunately, because we have such a strong senior management team, but you need to understand operations, finance, healthcare, public health. So there's a broad range of sort of at least exposure and some experience in a variety of areas that are really important. And then, of course, being able to be a leader, which is a little bit less tangible and harder to sort out, but certainly looking at experience, looking at style and interaction can be found. I had a breakfast for staff to just drop by after I announced, and a couple of people were talking about things they were looking for, which gives you some idea. They were talking about somebody with a big heart, somebody who's approachable, and can be the kind of leader that people can get behind and feel that they can give input. At the health center, we've had totally consensus environment, but we really value the input of our staff, our employees, and I think the majority of our employees feel like they have played a role in making the health center what it is, and being able to continue that, I think, is important to sort of keeping our culture of respect and being welcoming to visitors, to patients, to staff, and having an environment that people like to work in.
I think the new person who comes in will have to battle one of the most competitive times in healthcare, and also one of the most uncertain times in healthcare. And I just saw an interview with President Obama where he said the first thought of his day is keeping the economy going, because if he doesn't, he says, I think about it every day, and you got to keep this health center going every day with all the changes and everything. So looking at the future, you're probably leaving it at, you've taken it as far as you wanted to right now, and you'd be leaving. But what about the vision that's going to be needed to continue, making this place a thriving center?
Mm-hmm. Well, certainly the healthcare environment.
Look at all the places that are opening up now too. Element Care. I see some of the things on your list there that you want to expand to. They're doing now also.
Right. So we actually partner with Element Care, and after we get federal approval, their providers will be employed by the health center, and so we have we'll have a strong partnership with them. They're doing something that we don't do, so they're providing basically day health to very fragile individuals who otherwise would probably be in skilled nursing facilities, and we're helping them to do that. So that's not a service that we provide or plan to provide. So that's one example of partnership that's so important to the city and to the health center. In terms of the healthcare environment, you know, it is a little bit like, what do they say, building the plane while you're flying it or something like that, because we know that things are changing, and we know that down the line we're looking at global payment, sort of a little bit like the old HMO of paying us per member per month. We are part of a mass health sort of initiative that is a pilot for doing that. So we're getting experience with that. So we know that's what we're moving towards. That means that we have to have better coordination of care, better care management, really looking at continuity of care across all of the arenas where people get their health care. But right now, most of our payment is per visit. So we're doing things one way, anticipating that we're going to end up another way, but we have to function in this environment while we're planning for the future. So we're successfully doing that. Our infrastructure has improved greatly. Our ability, partly with the help of Henry, to gather data and analyze that data, show outcomes. This is going to be more than you ever wanted to know. But some of the payment is moving towards payment for outcomes. So we're much better equipped to look at that now and putting systems in place that help with care management and coordination of care, so that we're kind of looking at the whole well-being of the patient. And then the other piece of the future is kind of the public health, the community health side, where we're looking at what are the social determinants of health, and in addition to health, medical, behavioral health care, what do people need to be healthy? So our community health programs focus on that, whether it's working with the city on mass in motion, good nutrition and exercise, or working on domestic violence, or any of the other number of programs that we have in the community. And how do you help people with their needs for housing, refer them to CTI, but making sure that they get there, for example.
You sound like Norm when he talks about complete connected care. You know, that's it.
It's a good slogan.
Yeah, the mantra is very similar.
Yeah. It's what the community and individuals and families need in order to really be healthy.
So do you see more resources going into mental health in the future?
I hope so. I mean, it's improving, and a big part of what we're focusing on now is the integration of medical services and behavioral health services. So behavioral health, mental health, and substance abuse treatment. And certainly a huge need. And for example, it's hard to control your diabetes, manage your diabetes if you're depressed. And so there's an interaction between mental health and medical health.
Maybe not for this, I'm just curious, but what role has the health center played in the opiate crisis here in the city? You know, Baker's come out with a proposal concerning the prescriptions and holding a patient against their will. Just what kind of role has the health center been a big part of that, or is the health center kind of removed from that whole issue? I'm just curious.
Yeah. Well, we have substance abuse outpatient treatment, and so that's very important. We have been a part of the Greater Lowell Health Alliance Substance Abuse Task Force, which is really focusing a lot on opioid overdose and opioid dependence and treatment. We have a program called the Office-Based Opioid Treatment Program, which uses Suboxone for treatment of opioid dependency. And that has been very successful for a lot of people. So we've been working both with community education and treatment to focus on this. We also provide for opioid overdose.
Narcan?
Thank you. And provide education about how to use Narcan. So those are some of the ways we're partnering with others on that.
Do you think Baker's proposal was a good idea? Is that something you support?
I think the fact that he's focusing on this is really important. There are so many deaths and so many lives ruined by opioid dependency. I think in terms of the exact number of days that you should prescribe, I'm not sure I am the best person to give an opinion on that, but I think the fact that it's getting attention is just so critical to improvement of the situation.
Just a small thing that I'd mention, I guess, is that the Community Foundation came across a video about called Pleasure Unwoven, where a doc who has recovered from his own addiction talks about the effect of substances on the brain. And I think it's a pretty educational piece. So we're showing that actually at the health center to a group of health-related organizations. And the idea is to try to get their feedback about whether or not it would make sense to get a number of these videos and distribute them to school systems and PTOs and other organizations, that just as an education tool, so that people can understand that there's a reason that your brain reacts in a certain way to this stuff, and there's duality too. You talked about depression or anxiety or other issues that people are facing. Oftentimes addiction is fed by that duality. So it's a complicated issue, but this tells the story in a very straightforward way, so that you can understand why it's so difficult to overcome as a disease. Just to try to make people aware.
Yeah.
So it's a small thing, but it's just another example of the kind of effort that could be undertaken.
It's also true that many times people don't seek treatment for their substance use disorder, but they do go to the doctor, and we're doing a lot more with screening for drug and alcohol issues when people have a medical visit, and that's often a time when something can be picked up. People often listen to their doctor, and the doctor can make suggestions and do kind of a handoff to one of our social workers who are right in the department, and try to begin to engage people in the idea of treatment.
Okay, we go on to part two,
Okay.
expansion.
Okay. So,
I'm going to talk about the real estate part of the deal.
okay.
So Bruce was mentioning that they were at 100,000 square feet in 161 Jackson Street and already have a need to expand. And that's pretty remarkable given that they came from 37,000 square feet in different locations throughout the city. So 101 Jackson Street is the remaining 100,000 square feet that's part of Mill Number 6 in the Hamilton Mill Complex. It also is 6 floors, and the health center is looking to add new services, which I guess Henry will talk about, and the health center piece is probably gonna be in the cost, in the range of 18 to 20 million. We're still in the process of doing design work and cost estimating, with the goal of closing the transaction by the end of January and starting construction within 60 days thereafter.
Who owns that building, Steve?
It's owned by the health center.
Okay.
Yeah. And they own both condominiums. It's kind of interesting, the reason that they own 101 is that at the very end of closing the financial transaction on 161, the historic credit investor said, we're concerned about someone else owning the remainder of that mill, because if they fail to comply with the Secretary's standards for historic preservation, our $5 million investment will be subject to recapture. So they said, we want you to own that too. So at the very end, we negotiated a purchase money mortgage with Bank of America and Architectural Heritage Foundation. So that's why they ended up owning 101, and it's fortunate that they do, because now they can use that space for their expansion.
Okay.
So they'll be taking about 50,000 square feet of the 100,000 square feet and reserving another 16,000 square feet for future expansion. So floors 1 through 4 will be for the health center. And then the upper 2 floors, we're looking at developing as housing use. And there's discussion about whether or not it should be workforce housing or whether or not it should be structured in some other way. So the deal also is, the reason for moving so quickly is twofold. One is that they need the space in order to provide better services to their patients, but it's also part of the financing picture. The deal does involve new market tax credits, and the way the community development entities who receive the allocation of tax credits work is that they are eager to close on the allocations that they have within a certain time frame, so that they'll be more competitive the next time there's an application round for additional credits. So they're anxious for this to close by the end of January of 2016. So we're in a race now to get all of the design completed, get all the permits in place, and get ready for the financial closing, which means securing the other portions of the financing structure, everything from debt to state historic credits, and getting to the end zone in January.
So this is all happening simultaneously with your search?
Who purchases the new market tax credits?
Well, in the
Investors?
first case, it was U.S. Bank that purchased them, and we've had discussions with them at this point, and there's a definite interest on their part in purchasing them. The first deal was, this deal is a little bit more complicated to finance. For one reason, there's no stimulus program from the feds. Last time they received a $9 million grant from the feds under the stimulus program. And the second reason is that the IRS and National Park Service rules are such that we'd have to exceed the basis or the cost in the first phase with the second phase in order to qualify for the federal historic credits. And we're not going to be able to do that because the costs are going to be lower. It's a smaller project. It's a different project than the first phase was. So the equity that would come from that federal historic credit, we're going to have to do without. And there aren't too many sources out there to replace that. And one of those would be a capital campaign, which is really integral to the deal. And the other would be debt. The health center is in a position, fortunately, that it's expanding in a way that's going to generate the kind of revenue that they need in order to make the real estate project work. And I'm sure you'll have to explain to them how they're expanding.
You agree?
Dorcas and the rest of the senior leadership team really have been planning for the future. Really began planning as soon as we moved into the facility. We knew that there were still some unmet needs out in the community. And that's really reflected in our strategic plan. Our three-goal strategic plan outlines our collective efforts. We're currently still within the strategic planning period. So utilizing the opportunity that we have next door in 101 Jackson Street, we have gone through a very comprehensive process of putting together business cases and subsequently business plans to frame up the expansion plan as well as the introduction of new service lines. You have a document in front of you which highlights some of these efforts. So, beginning with expansion, we are looking at expanding our same-day access center on floor number 1, adding additional exam rooms to deal with the same-day needs of our patients.
That we're in the middle of the cycle and we're very strong. We just had a retreat last weekend to go over it once again and make sure we're all tightened up. And so I do feel that the future is very, very bright. We're very fortunate to have had Dorcas and her breadth of experience.